Cafe. I'm Sean Canan, and we are broadcasting live on November 12th from the studios of WMNF in Tampa. Later on in the show, we're going to hear about sea turtles on Pinellas County beaches and how they were impacted by this year's hurricanes. We'll also hear how Florida is dealing with mosquitoes. So stay tuned for all of that, and you can participate during this show by email, dj@wmnf.org. You can text 813-433-0885. You can also call 813-239-9663. And when you text in or call in or email us, why don't you let us know your first name and where you're calling from? That'll be helpful. And you can get in the queue now. First up, on this show, we're going to talk about health insurance and how you can find out if you're eligible to enroll in the Obamacare insurance marketplace during open enrollment. It's also called the Affordable Care Act. And open enrollment just started this month. And joining us now to talk about it is Katie Roders-Turner, Executive Director of Family Healthcare Foundation. Welcome back to Tuesday Cafe, Katie.
Sean, thanks so much for having me. I'm so glad to be back.
Yeah, I'm really glad you could come on the show and let people know how they can get some help. So let's talk about health insurance in Florida. How big of a problem is the lack of insurance here?
Well, it's pretty huge. Florida has one of the highest rates of uninsurance in the nation. Thankfully, right now is the time to shop for insurance and look for financial assistance and see what people may qualify for. And there's navigators all across Tampa Bay that are ready and waiting to help people shop for insurance.
Yeah, and we'll find out about how to contact them and all sorts of things during this segment of the program. One of the reasons or maybe contributing to the large number of people who are uninsured in Florida is that after the pandemic ended, a lot of people were dropped from the Medicaid rolls. So are some of them still looking for health insurance?
Yes, absolutely. So over 1.5 million people lost Medicaid after the state of Florida redetermined people's Medicaid coverage. And so many people may still be without health insurance. Thankfully, some may qualify for subsidies on the health insurance marketplace. There may be advanced premium tax credits that they could qualify for that could reduce the cost of their health insurance premiums to less than $10 per month, which is wonderful. Navigators will help people look at those options or even help them reapply for Medicaid if that's going to be the best fit for them. And then there are also safety net programs like Hillsborough County Healthcare Plan that people may also be eligible for. So this is really the right time to look for coverage options.
All right, so we've been talking about the Affordable Care Act marketplace, but remind people what that is, when it was instituted, and what types of products that you can get on the marketplace.
Absolutely. So when the Affordable Care Act was passed in 2010, it also instituted the health insurance marketplace, which is the federal government's one-stop shop to shop for affordable health insurance all in one place. And it opened up in 2013. So we actually just celebrated 11 years of the health insurance marketplace. So right now in Tampa Bay, there's actually 8 carriers in some places and over 160 plans to shop all in one spot. So you go to one website, healthcare.gov, and you can look for health insurance carriers that meet very specific criteria. They have to cover 10 essential benefits. They cannot discriminate based on someone having pre-existing conditions. And then you also can apply for financial assistance. So that's all on healthcare.gov. That's where the health insurance marketplace is. And so that's happening right now during open enrollment.
Yeah, so open enrollment is a time when anyone who wants to try to see if they're eligible for a discount or find out how much it would cost, anyone can kind of sign up and find out about these different health insurance plans that you said there were 8 different carriers here in the Tampa Bay area, 160 plans or more. So this is during open enrollment. When did that start and when does it end?
Thank you. So November 1st is when it started, and it's going to end on January 15th. And there's some really important dates to remember. So it started November 1st. So we're deep into open enrollment right now. So December 15th is an important date to remember. So December 15th, now that's the day to enroll if you want your coverage to begin by January 1st. So December 15th is important. If you already have a marketplace plan, it's really important to still look at your coverage, fill out your application, make sure you've got the best coverage option, make sure you're still shopping, make sure you've got the best deal. So December 15th, very important. Now, for some reason, if you're not paying attention, if you're focusing on the holidays, it's okay because January 15th is actually the very last day to apply for coverage to enroll for 2025. And that coverage date would be February 1st start date.
So try to sign up by December 15th if you can, but if you miss that date, you still have until January 15th to get care during open enrollment. Our guest is Katie Roders-Turner, Executive Director of Family Healthcare Foundation. We're talking about the open enrollment period in the Affordable Care Act's health insurance marketplace. This is Tuesday Cafe. I'm Sean Canan, and we're broadcasting from the studios of WMNF in Tampa. So this is open enrollment, but there are certain life events that will let you sign up for this type of health insurance at any time of the year. What are they?
Oh, awesome. Yes. So if for some reason it's outside of open enrollment, don't worry, because having a baby, getting married, losing coverage. So let's say somebody leaves their job and they've lost their employer-sponsored insurance, or say somebody's retiring early. So we see that a lot. So someone's not yet eligible for Medicare, but they're perhaps retiring early. So that's going to be an option to look at the health insurance marketplace because you've lost your employer-sponsored insurance. So those are called special enrollment periods, a qualifying life event. So outside of open enrollment, that would be a great time to look at the marketplace as well.
And one big change this year is that DACA recipients are now eligible. Who might be eligible now that wasn't eligible before?
Yeah, so DACA recipients. So this is actually a huge change. So prior to this year, those who had DACA recipients were not eligible to look at the health insurance marketplace, unfortunately. But now this year, effective November 1st, actually, and they can actually begin starting December 1st, have coverage on the health insurance marketplace. So we're pretty excited about this information. And so we'll be able to look at the health insurance marketplace, have health insurance, and possibly have access to financial assistance as well.
Yeah, so you mentioned earlier some deadlines, like sign up by the December 15th in order to have your coverage start January 1st. Is there an advantage to signing up earlier than December 15th? Might you be able to start your coverage earlier?
So I think one of the big advantages of signing up early is that you don't have to worry about it, right? So get it out of the way. You're able to take your time, really be thoughtful about looking at all of your options, make sure that you're evaluating everything, comparing your plans side by side, you're calling your doctors, making sure that everybody's in network. Now, your coverage will still start effective January 1st. It won't start necessarily any earlier unless for some reason you've got a special enrollment period that's going to have your coverage begin on December 1st. But if you're just enrolling because of traditional open enrollment, it still would only start January 1st. But we're definitely encouraging everybody to sign up as soon as possible, just to make sure that you're getting it out of the way, you're getting all your ducks in the row, and then you can go ahead and you can enjoy your holiday season and know that your coverage is started as soon as possible.
What if there's someone who already has health insurance, either because they get it through their work or because through a family member that they get it through their work? Would it still make sense to kind of take a look at what some of the options are in the marketplace?
So if you have if you have a spouse or a dependent and you are covering them through your employer-sponsored insurance, and it is excessively expensive for you to cover them through your employer-sponsored insurance, I would encourage you to look at the health insurance marketplace, because there is a chance that you may be eligible and your family may be eligible, your spouse or your dependents may be eligible for financial assistance to reduce the cost of their coverage on the health insurance marketplace. And that's new. That's new as of 2023. So if it is very expensive for you to cover your spouse or your children/dependents on your employer-sponsored insurance, look at the health insurance marketplace. And navigators at the Family Healthcare Foundation or at our partners like Baycare, Tampa General, we can help you look at that and compare the costs versus employer-sponsored versus marketplace, because it may be cheaper to look at the health insurance marketplace, and it might not, but we're always happy to have those conversations with you.
Our guest is Katie Roders-Turner, Executive Director of the Family Healthcare Foundation. This is Tuesday Cafe. I'm Sean Canan, and we're broadcasting from WMNF in Tampa. And you've talked about navigators. So for people who aren't familiar, these are employees who help people walk through the process of finding health insurance. How can people get in touch with a navigator, and what might that experience be like?
Thank you. So navigators we're funded generously by University of South Florida's College of Public Health, the Children's Board of Hillsborough County Health and Human Services, Florida Healthy Kids, Polk County Healthcare Services, and we're totally free. We have to get federally trained every year. We're experts. And we're always going to provide one-on-one application assistance. And it can be virtual or it can be in person, it can be over the phone. And so basically, we are your friend to talk through health insurance options. And so we will help people fill out applications for health insurance programs. It can be healthcare.gov. It can be Florida Kid Care. It might be a safety net program like Hillsborough County Healthcare Plan or Polk County Healthcare Plan. Whatever is going to help someone get the most affordable or no cost access to healthcare or medical services. We will help people compare plans side by side, understand what's a deductible, what's co-insurance, is your doctor in network. We really want to make sure that you understand what are your medical costs to make sure you're going to get the best deal to help you access medical services. And it can look like whatever you want. So if you just want us to help answer a few questions, or if you want us to set up a 2-hour appointment to go from application through enrollment, that's what we're going to do for you. And it can be sitting in an office or it can be sitting in a Zoom room, whatever's going to be the best fit for somebody.
And you talked about some terms that people who are dealing with insurance, health insurance, are going to come across. So maybe we should talk about what these things mean. What is a deductible? What are some of the other terms that people are going to encounter when they're comparing plans and try to figure out what's best for them?
Yeah, absolutely. So a deductible is going to be what you may have to pay before your health insurance plan is going to contribute to the cost of your medical services. And your out-of-pocket expenses really are going to be very specific to what your respective health insurance plan looks like. Some people may choose to pick a plan that has a low premium. You may then have really high out-of-pocket expenses. Alternatively, someone may choose to have a higher premium, but that may be because they have a more complex medical situation and they want their out-of-pocket expenses to be a lot lower. And so those are conversations that we have with people every single day, all year long as navigators, to really try to find a plan that's going to fit themselves and then their family as best that we possibly can. And sometimes we find that people choose a couple of different programs that are going to fit their family as best as possible. So for example, we've got some people who might choose to have adults on the health insurance marketplace, but then we've got kids and that same family who are going to be on the state of Florida's health insurance called Florida Kid Care. And the best part about being navigators is that we're well-versed and trained in all different types of publicly funded programs to best serve a family, to get them into the right program.
And in addition to the programs you just mentioned, Florida Kid Care and the Affordable Care Act, which is a federal service, there's also, had mentioned these a couple of times, but let's talk a little bit more about these options that are the county health departments. For example, in Hillsborough County, how can someone find out whether they might be eligible for their county's health program?
Oh, yeah. So it's really wonderful in Tampa Bay. We've got a couple of really incredible safety net programs or local county based programs. So in Hillsborough County, there's an amazing program. It's called Hillsborough County Healthcare Plan. And this is a no cost program for Hillsborough County residents. It's for county residents up to 175% of the federal poverty level. So it's a little over $20,000 for a household size of one in income. We'll help people apply for that program, help them get enrolled. It's no cost medical services, emergency room services, primary care, specialty care, no cost services for a whole year. So it's amazing. Pinellas County also has a no cost medical service as well. So that's wonderful. And then Polk County also has a county-based healthcare program too. So if you aren't aware of those healthcare programs and you're a resident of either Hillsborough, Pinellas, or Polk County, navigators at Family Healthcare Foundation would be happy to help you apply for those if you're eligible for them.
And so if people want to get in touch with a navigator, how can they get in touch with Family Healthcare Foundation navigators? What's the telephone number? What's the website?
Yeah, absolutely. So our phone number is 813-995-7005, and our website is www.familyhealthcarefdn.org. And we are part of a statewide network of navigators. We're part of the statewide Covering Florida Navigator Project, so coveringflorida.org. So there are navigators just like us all around the state of Florida. So we cover Tampa Bay. So Family Healthcare Foundation partners with Baycare, Tampa General Hospital, Evra Health in Pinellas, and Premier Community Healthcare in Pasco and Hernando. So those are our partners in Tampa. And then just like us across the state, Covering Florida navigators are all across 67 counties.
Well, I want to thank you very much for coming on Tuesday Cafe, Katie.
Sean, thank you so much. This is always so wonderful. I so appreciate you.
Yeah, I'm glad that you could bring this information to all of our audience. Katie Roders Turner is Executive Director of Family Healthcare Foundation, and we've been talking about Obamacare, open enrollment, and for the Affordable Care Act health insurance marketplace. This is Tuesday Cafe. I'm Sean Canan, and we're broadcasting live from the studios of WMNF Tampa. And we're going to switch to our next topic right now, which is sea turtles and beach nesting and our recent hurricanes. And joining us now is Clearwater Marine Aquarium's Sea Turtle Conservation Program Manager, Carly Oakley. Welcome to Tuesday Cafe, Carly.
Thank you.
I'm really glad you could join us. So why don't you first tell us about the Clearwater Marine Aquarium?
Yeah, so Clearwater Marine Aquarium is a nonprofit organization. So we are responsible for not only educating the public and the future generations, but we also are big on our rehabilitation and our rescue efforts.
And one of the most famous rescues you had was Winter the dolphin, who people may know from the films. Remind people who Winter was.
Yeah, so Winter was one of our most popular rescues that we had. So she came to us with part of her tail that had began to fall off. Eventually, the flukes did fall off completely, of which we were able to work with her and create a prosthetic tail. Winter was with us for 16 years. She actually passed away 2 years ago yesterday. So she was with us for a long time, inspired many with many different physical disabilities as well as mental health and or other conditions that she was able to actually inspire other people to continue and work forward into doing whatever they put their minds to.
And what we're going to talk about in the next several minutes is we'll talk about sea turtles in Pinellas County. So give us a crash course on sea turtles. What should people know about these turtles before we get into talking specifically about what happened this season with sea turtles?
Yeah, so sea turtles are an endangered species. There are 7 different species in the world. Here in the state of Florida, we primarily see 3 different species nest on our beaches. In Pinellas County itself, we primarily see the loggerhead sea turtles. So sea turtles spend the first few of their lives kind of just growing and getting big enough to reproduce. And when they do already, they'll come back to their natal beach. Now, what that is simply the beach where they themselves hatched out, made it to being this reproducing adult. So when they come onto the beaches, they will either like the area or they won't. We are responsible for marking every single nest as well as false crawl that we see. A false crawl simply is where a turtle comes up, for whatever reason, doesn't like the area, turns around, comes back, or goes back into the water. She will come back several times. Eventually, hopefully, she does nest, and we'll mark that off and watch it every single day until it hatches. So our main responsibility with my team is making sure that we're watching those nests all the way through the incubation period. Sea turtle nesting season here starts May 1st and goes to the end of October. But we start a little bit early just in case we have some early nesters.
And that's, I believe the coast that you're responsible for is 21 mile stretch of beach in Pinellas County. Is that right? So tell us how during the May through October nesting season, how many nests were there and how does that compare to a typical year?
Yeah, so like I said, we start patrolling physically here April 15th. We start 30 minutes before sunrise, and we do 21 miles of beach every single day, looking for those different emergencies and taking that biometric data. This season, we did see 271 nests, whereas the year before, we've seen quite a bit less than that. Our sea turtles tend to be on a 3-year cycle. So we were expected to have a lower year last year anyways. So this year this last season we're expected to have a moderate year, of which we did. So at a normal season, we'll see around 300 nests in one season. And then normally we like to see a 1-to-1 ratio when it comes to nest to false crawls. However, this year we had a large increase in false crawls. We had 325 false crawls this year as compared to 271 nests.
What might cause false crawls?
Yeah, so there's several different things that can cause false crawls. Either the sea turtle can see that there's too much artificial lighting. What that is simply the use of bright lights. So white light is very deterrent towards sea turtles. It causes them to return back to the water, as well as causes our hatchlings to become a little bit confused and orient towards civilization rather than the water. Female sea turtles, if they do see this bright light, they will crawl back into the water. Another few things could be is leftover beach furniture. So beach chairs, tents, buckets, any sort of trash, that can definitely spook off our sea turtles as well. When they come out of the water, they can't see as clear as they would be able to under the water. It's much like us being able to open our eyes in the water. We don't get to see that crystal clear image. So that could be a reason as to why they would false crawl. Another thing is just simply the public. People coming up to the turtles instead of giving them space. Like I mentioned, they do get spooked very easily. So if they detect any sort of movement, they will turn around and go back into the water.
How many species of sea turtle nested this season on Pinellas County beaches?
Yeah, so in our area of beaches, we were able to see 3 different species. That's one of the first times we've actually ever been able to do that here at Clearwater Marine Aquarium. So normally we primarily see loggerhead species, which does make up a majority of our nests. This season, we are also able to document 2 green sea turtle nests and also our very first leatherback sea turtle nest.
So the first time ever a leatherback sea turtle nest. Do we know if those eggs hatched?
Yeah, so we got to go up to it first thing in the morning. That's when we first started to see the boil, or where the hatchlings started to erupt at the surface. So a first few of them, they didn't hatch within the time frame that's provided to us by FWC. So we were able to collect those and bring them back to the Clearwater Marine Aquarium just for the rest of the day. We did go back at the nighttime, and while we were releasing those hatchlings, we were actually able to see the entire nest hatch out and go to the water by itself. So that was definitely unique for us as well, that we got a little extra present on top of not only getting to see the hatchlings, but also getting to see the entire nest hatch out.
So quite a number of leatherback sea turtle hatchlings made it into the water off of Pinellas County beaches this summer.
Yes, and it was very, very exciting. We saw around 50.
And that might indicate that one day some or a lot of those same turtles might come back and nest again.
Yes, we are very hopeful that they'll come back to the area. Again, they tend to come back towards their natal beaches. So we're very hopeful that everybody who made it out makes it into being a reproducing adult. However, sea turtle hatchlings have a survival rate of 1 in 1,000. So that's why it's very important that we try to make sure that everybody makes it out as best as possible.
I want to remind people that we're speaking with the Clearwater Marine Aquarium's Sea Turtle Conservation Program Manager, Carly Oakley. We're talking about sea turtle nesting on Pinellas County beaches. This is Tuesday Cafe. I'm Sean Canan, and we're broadcasting from the studios of WMNF in Tampa. Let's talk now about the storms this summer. How did the 3 major storms, and if there were any minor storms that impacted the nests, what were the impacts there?
Yeah, so our first storm that came through was only a tropical storm by us, but ended up being Hurricane Debbie. Hurricane Debbie only brought 2 feet of floodwaters into our beaches. However, it was significant enough that we did end up losing a large percentage of our nests. I believe we said it was around 60% is how much we lost in that first storm. We did see some nests hatch out before Hurricane Debbie. After Hurricane Debbie went through, we did evaluate our beaches, and some nests did make it through that storm. We did have quite a few nests hatch out between Debbie and Helene. Unfortunately, when Helene came through with the large storm surge of around 6 feet, it did wipe out the rest of our nests we had that season. However, we only had a small handful of nests left, so it really wasn't as detrimental as Hurricane Debbie was. Now, Hurricane Milton, we didn't have any hurricanes that were left. However, it did cause Florida Fish and Wildlife to end our season just a little bit early, mainly due to lack of activity and also the condition of the beaches.
And those hurricanes, especially Hurricane Helene and then Hurricane Milton, kind of changed the landscape of a lot of the beaches in Pinellas County. Some of the sand dunes were eliminated or moved, and some of the beaches kind of got maybe shallower and flatter. I'm not sure how best to describe it, but what impact do you think this might have on sea turtle nesting seasons going forward?
Well, we are very hopeful that it doesn't have a negative effect. Unfortunately, a lot of the dunes did get washed away in these last few storms, which provide blocking of that artificial lighting. We may see an increase in the already large amount of disorientation events that we do see with our hatchlings. However, in previous years, we've had storms go on the east coast of Florida, completely annihilate the beaches there, but they did have a record-breaking season that next season. So we really are hopeful that it ends up happening for us too this upcoming season.
And are the beaches themselves, the flat parts of the beach, is there anything about them that would indicate that they are still able to be deep enough maybe for nests?
Yeah, so any sand is good. Like I said, they just simply need a soft area to be able to create their egg chamber and then cover it. The only other problem that we would really honestly face is if we had any large surges, any large high tides, king tides, that unfortunately can cause a negative effect on our nests as well. So we're hoping that they're able to get up far enough that that water necessarily won't reach those areas. With the beach being flattened, that sand did have to go somewhere. So it did not completely annihilate our beaches. It just made them very flat and then doesn't provide any sort of dune vegetation for the turtles to necessarily nest in and keep them away from that high tide line.
I want to remind people that we're speaking with the Clearwater Marine Aquarium's Sea Turtle Conservation Program Manager, Carly Oakley. We're talking about sea turtle nesting on Pinellas County beaches and how they were impacted by the hurricanes this year. You're listening to Tuesday Cafe. I'm Sean Canan, and we're broadcasting from the studios of WMNF in Tampa. If people see sea turtles that need help, what can they do?
Yeah, so the first thing that we ask that you do is you leave them alone. Please do not interact with these animals. They are wild as well as they are endangered. So if you are caught tampering with, harassing, touching, even with the intent that you think that you're helping, you can receive a hefty fine and possible jail time. So the first thing we do is ask you to get hands off. Next thing that we ask you to do is to call our local stranding hotline. That is the aquarium to the phone number to the aquarium. The extension number is 1. What we then will ask you is simple questions: where you are, what you're observing, and how big the turtle is. We have somebody on call on staff 24/7, so we will be able to respond to those situations as needed.
And let me give out that phone number. It's 727-441-1790, extension 1. If you notice a sea turtle that needs help, stay away from it, but call that number, and you can call that number 24 hours a day?
Yep. So 24 hours, 7 days a week, even through the holidays, we always have somebody that is on call. And once you leave that information, we will go ahead and respond to it as accordingly as we can.
What are some tips that you can give beachgoers, whether they're residents or tourists, about having a sea turtle friendly beach experience?
Yeah, so the first thing that we like to say that should resonate in everybody's brains is leave nothing but footprints in the sand. We should live and breathe by this. That simply means that any trash that you're bringing with you, we all like to have picnics on the beach. We ask that you bring all that trash back with you. Any beach chairs, beach toys, tents, anything like that, please make sure that you're taking everything that you bring with you back off of the beach. Because if you do leave those items on the beach, it can cause injury to our females and also deter them from nesting. Another thing is we enjoy building sand castles and digging sand holes. That is perfectly fine. But we just simply ask that you knock down your sand castles and fill in your sand holes at the end of your beach trip. Simply, again, because it can not only spook off our nesting females, but it can also, if the holes are big enough, catch our nesting females as well as our hatchlings. It can also cause injury to humans as well. So it's just easier for all of us to make sure that that beach remains flat and clean. The last thing that everybody can help us out with is by implementing the use of red or amber lighting. Now, this detection is harder, or this wavelength is hard for our sea turtles to detect. So that allows you to have some sort of light out on the beach if you have to have one. This does include flashlights. We do know that you like to catch the ghost crab, but unfortunately, we do ask that you deter yourself from using those bright flashlights and instead use the red or amber. That way you're not disturbing any sort of nesting female or hatchlings that are making their way back to the water.
Well, Carly, is there anything else that our audience should know about sea turtles, Pinellas County beaches, and just becoming a healthy area for a good sea turtle population?
Yeah, just being educated and aware of what's going on and when it's happening is a big thing. So my team is working actively to educate all of our beachgoers and our locals. We have been able to receive a lot of support from our locals as well, that by helping us educate the public and letting them know, hey, let's build in those sandcastles, let's fill in those sand holes. Those are definitely the big steps and the easiest steps. The next thing we need to work towards is making it a completely turtle-friendly lighting area. We are working with different municipalities right now to get all of their lights switched over to that red or amber coloration. So that is one of the big things that we do like to educate towards, and it'll help us definitely in becoming more friendly towards sea turtle nests and hatchlings, making sure they make it to and from the water safely.
Well, I want to thank you very much for joining us on Tuesday Cafe, Carly.
Well, thank you so much. I appreciate it.
I'm really glad you could come on. Carly Oakley is Clearwater Marine Aquarium Sea Turtle Conservation Program Manager. This is Tuesday Cafe, and I want to invite our audience to participate now. What do you think of our topics so far? Do you have any things on your mind about the election results, or if there's anything else that you want to talk about? Here's the numbers to call: 813-239-9663. You can also send us an email at dj@wmnf.org. You can text 813-433-0885. Please let me know your name if you do call in or text in or email us in. And we're going to hear more about mosquitoes in just a minute. I also want to tell you about some WMNF events that are coming up.
I don't want to think like that.
Get ready to party, because on Saturday, December 14th, WMNF brings Caleb Caudle and the Sweet Critters to Bayboro Brewing in St. Pete. Caleb is a great songwriter with a top-notch band that always delivers. In the garage off his new album, Caleb pays tribute to intimate spaces like Bayboro, his favorite places to play.
My name was in the news. They told the town to go. I looked out from the stage on a sold-out show.
His joy and gratitude for a life in music energize every concert. That's Caleb Caudle and the Sweet Critters, December 14th at Bayboro Brewing. Tickets online at WMNF.org.
Caleb Caudle coming in concert for WMNF. You can get your tickets at WMNF.org. Well, this is Tuesday Cafe. I'm Sean Canan, and you can email us at dj@WMNF.org. You can text 813-433-0885, or you can call 813-239-9663. Maybe you want to still talk about the election results, or maybe you would like to talk about one of our topics so far. We've talked about the Affordable Care Act health insurance marketplace open enrollment, and we also spoke about sea turtle nesting in Pinellas County beaches. So if you have any comments about either of those topics, give us a call, 813-239-9663. Right now, we're going to hear a story about how Florida deals with mosquitoes. And it's after the hurricanes, I'm sure you were well aware of the mosquitoes. They may have calmed down a bit with our dry season beginning a little bit early, it seems. But here's what we know about Florida and mosquitoes. This comes to us from WLRN's Tom Hudson.
A wetter than normal wet season is high season for mosquitoes. Mosquito control in the Sunshine State is battling both a public nuisance and a public health threat, and a fight funded by tens of millions of dollars of local property tax money. Which is why I caught a ride in a helicopter from the Lee County Mosquito Control District recently. It's the largest district in the state with a $40 million annual budget. Once we cleared through some air traffic, we were flying over scrub brush and grass dotted with salt marshes, prime breeding ground for mosquitoes. There are 54 species of mosquitoes in Lee County, but they only target about 15, the ones that bite mammals, like livestock, pets, and people.
So this area here, this is actually a big breeding one. So this is one we kind of keep a good eye on. This whole big area here, we actually do quite a bit of treatment in this area.
This is our pilot, Nick McCoy. Below us were waves of brush and flatwoods with huddles of pine trees, in a spectrum of green hues, with an occasional brush stroke here and there of brown, and then dollops of dark blue, water, set against the early afternoon sun. The Mosquito Control District uses helicopters like these to spray for bugs. We're not spraying on this flight, though.
Let's talk about number of mosquitoes that we can have.
This is Jen McBride with the Lee County Mosquito Control District.
If you can picture 1 square foot, so if you can picture that in your brain, 1 square foot, we've done research that says in a salt marsh area, you can have as little as 1,000 eggs and up to 39,000 eggs in 1 square foot. That's a lot of mosquitoes. You can see that there's probably not a lot of blood meals to choose from here.
Not a lot of mammals down there.
Not a lot of mammals. So what are they going to do? Look at all those houses right next to this area here. They're going to go to that area to find their blood meal. And this is that species that will travel long distances to find their blood meal.
Now, blood meal is what we would call a mosquito bite. It's the females who do the biting. They need the blood to survive and develop their eggs for the next generation of mosquitoes. It's that bite that's at best a public nuisance and at worst a threat to public health.
If you look at the amount of money that we spend on disease mosquitoes versus nuisance, it's a majority of our budget.
This is Andrea Leal. She is the executive director of the Monroe County Mosquito Control District. The Florida Keys may be one of the smallest counties in the state of Florida with just 82,000 residents, but it spends millions of dollars on its bugs. Its budget this year is $18 million.
When I first started back in 2003, we didn't think about things like this until 2009 and 10, when we saw first dengue outbreak that we've seen in the Florida Keys since the 1930s. You're seeing more of that public health aspect than what you did historically.
Helicopters are just one of the tools used in the fight against mosquitoes in Florida. There are trucks with traps and sprayers, airplanes, and these. Chickens. Yeah, they're called sentinel chickens. Sentinel, like keeping watch. Here's Jen McBride again. She's the communications director of the Lee County Mosquito Control Board.
It's kind of like the layer of protection for us prior to it becoming with humans.
Most counties draft chickens as part of the system to monitor mosquitoes. The chicken's blood is tested for antibodies to diseases carried by the bugs. And then there is using the bugs themselves. The Florida Keys have been conducting an experiment. It's been one of only 2 places in the country where genetically modified mosquitoes have been approved by the EPA for release.
From what we saw in the neighborhoods where we were doing releases, in comparison to those neighborhoods that we weren't, we did see a population suppression.
Andrea Leal again is with the Mosquito Control District in the Keys. The permit for Monroe County allowing the use of the bioengineered bugs expired this spring, so it did not release any this bug season. I'm Tom Hudson in Miami.
Well, that was a story about mosquitoes, and especially, I thought that you might be interested in hearing the update about the genetically modified mosquitoes that they've been releasing in the Keys. We've covered that story for the last few years, but I just wanted to remind you of that and see if you have any thoughts about any of the things you learned in that mosquito segment there about how the state of Florida and how the different municipalities, the counties and the cities go about dealing with the mosquito problems, not just nuisance mosquitoes, but also ones that are carrying very serious diseases sometimes in the state of Florida. So if you have any thoughts about any of that, you can call in to Tuesday Cafe. The number is 813-239-9663. You can also email dj@wmnf.org. You can text 813-433-0885 and sign your name. And you can also, I think I said dj@wmnf.org is the way that you can email us. So one other thing I wanted to remind you about is that you may have heard this on the WMNF news headlines in either yesterday evening or this morning. And you'll probably hear about it in the Scoop as well, which is coming up at 1:01, our 5-minute news and public affairs summary of the day. Hope you enjoy the Scoop and that you subscribe to it. But one of our top stories today is Chris Young did a story about how the price of rent is so high in parts of Florida that people need to work more than 50 hours a week just to afford their rent. So let's listen to Chris's story. And if you have anything, if you want to tell us your story about rent and how much you have to work and how affordable or unaffordable your rent is, give us a call, 813-239-9663, or text 813-433-0885, and we'll share your story. So here's Chris's report on the price of rent in Florida.
The report is by financial technology company Self and published in Newsweek. It showed that some Florida residents need to work 63 hours a week to cover rent. That's based on Florida's 2024 median rent of $2,033. It's a problem that Kimberly Overman, founder of the Housing Leadership Council in Tampa Bay, says has wide-reaching effects.
And when people can't afford the rent, when they can't provide shelter for their kids, when they're unable to actually provide various different basic needs because their rent has gotten so high, they're not going to be happy. They're not going to be comfortable.
And it's not just families being affected.
We're finding that a lot of our high school and college students are choosing to stay with their parents. It's because they can't afford to find a place on their own that they can actually earn enough to be able to afford on their own, even though they may have a college education.
On average, the report found 50 work hours per week are needed to cover monthly rent costs in the U.S. Chris Young, WMNF News.
Working 50 hours a week just to cover your rent, and that's the average. It's worse in parts of Florida here. So what are your thoughts about that and about rent and housing costs in Florida and the Tampa Bay area? Our number here is 813-239-9663. You can email dj@wmnf.org. You can also text us at 813-433-0885. Let me read from the AP right now. This is a story that came out in the AP this morning. It says, the new Louisiana law that requires the 10 Commandments to be displayed in every public classroom by January 1st has been temporarily blocked after a federal judge granted a preliminary injunction today. The judge said the law is unconstitutional on its face, and plaintiffs are likely to win their case with claims that the law violates the First Amendment. The ruling marks a win for opponents of the law who argue that it's a violation of the separation of church and state and that the poster-sized display of the Ten Commandments would isolate students, especially those who are not Christian. Proponents say that the measure is not solely religious, but that it has historical significance to the foundation of U.S. law. The U.S. District Judge in Baton Rouge issued the order in an ongoing lawsuit filed by a group of parents of Louisiana public school children. They say that the legislation violates First Amendment language forbidding government establishment of a religion and guaranteeing religious liberty. The new law in Louisiana, which is a reliably Republican state that is ensconced in the Bible Belt, was passed by the state's GOP-dominated legislature earlier this year. It's been touted by Republicans, including former President Donald Trump, and I should say President-elect Donald Trump as well. And it's one of the latest pushes by conservatives to incorporate religion into classrooms. And the AP lists Florida legislation that allows school districts to have volunteer chaplains to counsel students. It also mentions Oklahoma's top education official ordering public schools to incorporate the Bible into lessons. So that's part of this story here from the Associated Press, that a new Louisiana law that requires the Ten Commandments to be displayed in every public classroom by January 1st has been temporarily blocked by a federal judge when the judge issued a preliminary injunction saying it violates the First Amendment, or it's likely, the case is likely to win on the idea that the law violates the First Amendment. So if you'd like to talk about that, you can give us a call as well, 813-239-9663 or WMNF.org. And we've got Tom from St. Pete who wants to talk about healthcare. Hey, Tom.
Hello. Yeah, I just had a quick question. I'm a little confused. I've had, Obamacare a couple years, but with the change in presidency, should we be concerned, or would this take years to dismantle? I'd like to hear if anyone has, some information about that.
Yeah, of course. I can't say I'm an expert on that, but it's certainly a question that people are asking. And, it's a law that was passed by Congress and signed by the president, and it's in effect. And certainly the Congress could withdraw it if they wanted to. It seems like there's not very much political appetite for that.
Yeah, that's my worry.
So, yeah, we'll see what happens. I think there's been times in the last few months that the candidate Trump was saying he didn't want to repeal Obamacare, and then the fact checkers said, wait a second, you did say you wanted to repeal it. So there is a back and forth. Who knows how it's going to end up, but it's definitely a question, Tom, I really appreciate, because it's something that we'll definitely be watching in the next few months.
Going to definitely change things at some point. But thank you.
Well, let me ask you, since I have you, you say that you have health care through the Affordable Care Act health insurance marketplace. How has it been for you?
I think it's a bit, I don't like all this big money subsidies to, all the big drug makers and everything, but it's like, I need health insurance. I'm going to be 60 years old next year. So I've gotten insurance since I've been working full time again the last few years.
So you went off of the marketplace and onto your employer's insurance? Is that what you're saying?
No, I didn't have any insurance for quite a while.
Yeah.
But I've been working full time the last 2.5 years, and I've been on their plan. They didn't have plans, so I went ahead and got Obamacare.
All right. Thanks so much for calling in, Tom.
Thank you. Appreciate allowing people to call. Thank you.
Yeah, thanks so much. This is WMNF Tampa, 88.5 FM, and we are broadcasting live on the 12th of November from the studios of WMNF in Tampa. This is Tuesday Cafe. I'm Sean Canan, and we're asking people to comment about the stories that you've heard today, whether it's the open enrollment for Obamacare health insurance marketplace, or whether it's sea turtle nesting on the Pinellas County beaches. Do you live along the beaches? Do you think that your community is doing enough to keep the area dark after sunset? Wow, that was tough for me to say. Do you think that the tourists are aware enough that they should be keeping the beach clean when they leave? These are all sorts of questions. It's good to hear that there were some sea turtle nests that hatch before all the hurricanes. It was sad that the ones that were still left, the few that were still left, were destroyed by Helene and so on. But if you have any thoughts that you'd like to mention about the sea turtles, give us a call, 813-239-9663. You can also email dj@wmnf.org if you have any thoughts about that judge that just put on pause the Louisiana law about displaying the 10 Commandments and how that might apply to laws in Florida and so on. Give us a call, 813-239-9663. There are other events that WMNF is putting on, so while we're waiting for your phone calls, I'm going to let you know about our record sale.
The WMNF Fall Record and CD Sale takes place in our live music studios, Saturday, November 16th.
Mix and mingle with the WMNF community while you find hidden treasures all in good condition and priced to move.
Classic rock from the 60s, 70s, and 80s.
Jazz.
Soul.
Singers.
Songwriters.
Everything from ABBA to Zappa at the WMNF Fall Music Sale.
Learn more at WMNF.org.
Yeah, we've got boxes and boxes and boxes of records. So I guess I should say piles and piles and piles of records, but they're nicely stacked in boxes. Yeah, come on down Saturday, and for the record sale, you'll find some gems well priced, and there's also some cool books that are for sale, and it's going to be great. And if you'd like to call in, you can call in at 813-239-9663. We're going to go to Drew in Bradenton in just a second, but I want to give you the opportunity as well. It's dj@wmnf.org, or you can text 813-433-0885. Let's see if we can get Drew on the air. Hey, Drew, you want to talk about the 10 Commandments and the law that was just put on hold in Louisiana?
Yeah, I was wondering how this is going to affect schools in Florida, because I have a younger brother who is in middle school.
So this law, it only applies directly to the Louisiana law, but if there are laws in Florida that people are challenging on the basis of separation in church and state, of church and state, or on the basis of the no creation of state religion and so on, it's possible that the other judges could see things the right way. Why? What have you experienced with your younger brother and what he's seeing in school?
Well, I just know that he was enrolled into a Christian school, an elementary school, and I was just curious on how it's going to affect curriculum, specifically curriculum. Obviously, it's a direct contradiction to the theory of evolution and just specifically biology. Because in his Christian school, the curriculum taught him that the Earth was 5,000 or some odd years old. I don't know specifically the Christian science curriculum, but I just thought it was interesting because wouldn't science class directly contradict the religious rhetoric that they're trying to push? Like, how is that going to coexist?
Yeah, I mean, I think that a lot of people have the same questions that you have. And if your brother is going to a private school, then of course it would be subject to completely different rules than a public school.
Well, he isn't anymore. I'm just saying that he was before, and I saw firsthand the direct distinction between public school curriculum, specifically in evolutionary science, and the Christian one. Like, I just don't know to what level they're going to rewrite state curriculum to fit their Christian nationalist narrative.
Yeah, good point. Yeah, I appreciate that, Drew. I've seen textbooks like that as well that you're describing that have things that are glaringly factually wrong about science and about history and about geology and things like that, and yet they're still in a textbook meant for small eyes and the eyes of small people and young people. And so, yeah, very confusing. Well, I appreciate you calling in, Drew. Thanks to all of our callers and our participants today. And thanks so much to my guests. I want to thank Katie Roders-Turner of the Family Healthcare Foundation, who spoke about the Obamacare open enrollment. And I want to thank Carly Oakley with the Clearwater Marine Aquarium's Sea Turtle Conservation Program, talking about sea turtle nesting in Pinellas County. If you missed any of this show, or if you'd like to share it with a friend, you can find it on WMNF.org. You can watch those interviews. During this time slot tomorrow, Shelley will host Midpoint. Coming up next is Wavemakers with Janet and Tom Scherberger. Then at noon is Wide Awake America with Nadine Smith. She talks with investigative journalist Gareth Gore to dive deep into his explosive book. The book is Opus, The Cult of Dark Money, Human Trafficking, and Right-Wing Conspiracy Inside the Catholic Church. This has been Tuesday Cafe, coming to you live on November 12th, 2024 from the studios of WMNF Tampa. We also broadcast to St. Petersburg, Sarasota, and Lakeland. Thanks so much for supporting community radio. And The Scoop is at 101 this afternoon.